Hello everyone. I welcome you all to this on-learning platform on a course Industrial Safety and Fire Safety Management. Dear learners, in today's lecture, we will see our module 9, lecture number 31, that is First Aid, the Life Safety Procedures. These are the various contents which I am going to discuss today. Introduction to the first aid, key principle of first aid, basic first aid kit, common injuries and first aid, CPR and AED procedures, choking, bleeding and wound cares, burns, fractures and sprain care, first aid for specific age groups, and at last we will see our conclusion. Dear learners, let us see our first part, introduction. What is first aid? First aid is an immediate assistance or care provided to a person who has been injured or suddenly taken ill before the arrival of professional medical help. It's a crucial skill that can save lives and minimize the severity of injuries. What is the importance of this first aid? Let us see. So, first aid is a life-saving skill that can make a significant difference in critical situation. It not only reduces the pain and suffering but also increases the chances of a full recovery. Prompt and proper first aid can be difference between a life and death in any emergencies. Dear learners, let us see what will be the objective of our this presentation. In this presentation, we will see or we will explore the fundamental principle of first aid. We will discuss the content of a basic first aid kit, learn how to respond to common injuries and emergencies including CPR and AED uses. We will understand how to handle specific medical conditions and allergies. Then we will discover the importance of first aid for different age groups and etc. Let us see our second point. What is the key principle of first aid? So let us see what this point say. Before taking any action, it's crucial to assess the overall situation. Ensure that the area is safe for both you and the injured person. Identify the potential hazards and take steps to minimize the risk. Secondly, we will see your safety and the safety of others should always be a top priority. Ensure that the skin is secure and if there is any dangerous, example fire, traffic, etc., take necessary precaution to protect everyone involved. Then in next step, we will approach the injured person calmly and confidently. Assess their condition by checking for responsiveness, breathing and sign of any life. Determine the nature and extent of their injuries or illness. The next step, once you have assessed the situation and the person's condition, provide appropriate first aid. This may including controlling bleeding, immobilizing fractures, performing CPR, administering necessary medications if available or authorized, and providing comfort. These key principles serve as a foundation of effective first aid. They guide your action and decision in providing immediate assistance to those in need. Remember that every situation is unique and your ability to access, ensure safety and provide appropriate care can make a significant difference in any emergency. Dear learners, let us see our next topic, that is basic first aid kit. In this area, we will cover what should be there in our first aid kit. A basic first aid kit should include essential supplies to provide immediate care in case of injury or illness. It typically contains adhesive bandages of various sizes, sterilized gauge pads and adhesive tape, antiseptic wipers and solutions, scissors and tweezers, disposal gloves, CPR face shield or mask, pain reliever, for example, aspirin or paracetamol. Then for allergic reaction, some antiseptic cream, thermometer, first aid manual and instruction, and at last, emergency contact number also should be provided in a first aid kit. Let us see what is the importance of having a kit at your home or in a workplace. So, accident and injuries can happen at any time. Having a first aid kit readily available at a home and in your workplace ensure you can respond immediately to injuries or medical emergencies. Also, it minimizes the infection, means promptly cleaning and dressing wounds with the supplies in the first aid kit can help prevent infection and reducing the risk of complications. Then it provides comfort and relief. First aid kit contains items to provide comfort and pain relief. Having these supplies on hand can ease discomfort until professional medical help arrives. Then emergency preparedness. A well-equipped first aid kit is an essential component of your emergency preparedness plan. It ensures that you are ready to respond to a wide range of situations from minor injuries to a major disasters. Then for a travel safely, means keeping a first aid kit in your car is especially important for road trips. It allows you to address injuries while on a road and provides a sense of security during travel. Remember to regularly check and the supplies in your first aid kit to ensure that they are up to date and in good condition. Having a well-maintained kit can make a significant difference in your ability to provide immediate care when it's needed most. Then, common injuries and for first aid. In this section, we will explore some of the most common injuries and medical emergencies and discuss the appropriate first aid measures for each. First one is cuts and scrapes. Let us see how to deal with cuts and scrape type of injuries. Clean the wound with the mild soap and water. Then apply an antiseptic to prevent the infection. Then cover the wound with a sterile dressing or bandage. If bleeding is severe, apply direct pressure with a clean cloth or bandage. Second injury is burn. For minor burns, that is first degree and some second degree burns, cool the burn with cold running water for at least 10 minutes. Cover the burn with a sterile non-stick dressing or clean clothes. Do not use ice, adhesive bandages or cream on burns injury. Then let us see the fractures. Means keep the injured person still and immobilize the affected area to prevent further injury. Use the splint or improvise with the allowable materials, that is rolled up newspapers or cardboard. Do not try to reline bones, leave that to medical professionals. Then for the choking, means encourage the person to cup forcefully. If the person cannot cup, perform the abdominal thrust to dislodge the obstructing object. If the person become unconscious, start CPR. Let us see what is CPR, cardiopulmonary resuscitation. Begin CPR if a person is unresponsive and not breathing or not breathing normally. Perform chest compression at a rate of 100 to 120 per minute. Combine chest compression with rescue breaths if trained in the ratio of 30 compressions to 2 breaths. Continue CPR until the professional help arrives or the person starts breathing on their own. Next, dear learners, let us see CPR and AED procedure. First, we will see cardiopulmonary resuscitation or CPR. So, CPR is a critical life-saving technique used in any emergency when someone's breathing or heartbeat has stopped. It's important to understand how to perform CPR correctly. First step is check for responsiveness. Ensure the person is unresponsive and not breathing or not breathing normally. Second step is for call for the help. Means dial 108 in India or local emergency number immediately to professional medical assistance. Next step is begin chest compression. Place the heel of one hand on the center of the person's chest just below the nipple line. Place other hand on top of the first hand and interlock your fingers. Position yourself with your shoulders directly over your hands as we can see in picture. Use your upper body weight to push down hand and fast at least 2 inches 5 cm deep at a rate of 100 to 120 compression per minute. Then allow the chest to fully recoil between compressions. Next step is rescue breath. If you are trained, then apply this. After 30 chest compression, give 2 rescue breaths. Tilt the person head back slightly and lift the chin to open the airway as we can see in picture. Pinch the person nose, shut and breathe into the mouth until the chest compression. Continue with cycle of 30 compression and 2 breaths until help arrives or the person start breathing on their own. So this is, dear learners, what about the CPR. Then next we will see AED procedure or external defibrillators procedures. So AED are portable electronic device that can analyze a person's heart rhythm and deliver an electric shock known as a defibrillation if necessary. This shock can restore a normal heart rhythm in cases of sudden cardiac arrest. AEDs are designed for ease to use by non-medical personnel. They provide clean step-by-step voice instructions on how to operate them. First procedure in AED is the chances of survival decrease by 10% for every minute that passes without a defibrillation in cases of cardiac arrest. AEDs allow for rapid defibrillation, significantly increasing the chances of survival. AEDs are becoming more common in public places, workplaces, and even homes. Knowing the location of the nearest AED and how to use it can be a substantial difference in a life-threatening situation. Understanding and practicing CPR along with knowing how to use an AED is a crucial for responding effectively to sudden cardiac emergency and improving the odds of survival. Training in CPR and AED uses is widely available and highly recommended by everyone. Dear learners, let us see our next point, that is choking. How to cure a choking person. Choking occurs when an object becomes lodged in a person's airway, blocking the flow of air. It's essential to act quickly and effectively to help a choking victim. Let us see what steps we have to perform for choking victim. First one is assess the severity. Ask the person, are you choking? If they can speak or cough, their airway is partially blocked. Encourage them to cough forcefully to try to expel the object. If the person cannot cough or speak, their airway is completely blocked and immediate action is needed. Second, we will perform the abdominal thrust. Stand behind the choking person and wrap your arms around their waist, as we can see in picture. Then next step we will perform, place a first just above the navel thumb side in. Grab your first with your other hand and give quick upward thrust into the abdomen using a strong inward and outward motion. Continue this thrust until the object is expelled or a person becomes unconscious. Then third step is, if the person becomes unconscious, gently lower the person to the ground. Call for emergency number 108 or your local emergency number immediately. Begin CPR with chest compression and rescue breath if you are trained, until professional help arrives or the person starts breathing. Dear learners, this is all about the choking. In our next step or next topic, we will see how to controlling a bleeding. So bleeding can range from a minor scrapes and cuts to more severe injuries. Properly controlling bleeding is essential to prevent infection and minimize blood loss. In this step, we will see our first step, assess the wound. Examine the wound to determine its size and severity. If there is an embedded object, do not remove it. Stabilize the object and bandage around it. Second one is direct pressure. Use a clean cloth, sterile gauze pad and your hand to apply direct pressure on the bleeding wound. Maintain steady pressure for at least 5 to 10 minutes or until bleeding stops. Next step is elevation if applicable. If the bleeding is from an extremely, raising it above heart level can help reduce blood flow from the area. Be gentle while elevating to avoid causing additional pain or injury. Then last resort means use the tourniquet only as at the last resort. If bleeding cannot be controlled by direct pressure, apply tourniquet proximal closer to the body to the bleeding side. Note the time the tourniquet was applied and release it only under the medical supervision. Dressing and bandage wounds. Let us see what the dressing and bandage should apply in any wound. Once bleeding is under control, it's important to properly dress and bandage the wounds to prevent infection. First procedure is to clean the wound. Means gently clean the wound with mild soap and water. Use an antiseptic solution if available to reduce the risk of infection. Second step is apply an antibiotic ointment if available. Means apply a thin layer of antibiotic ointment to the wound to further reduce the risk of infection. Third step is to place sterile dressing. Means cover a wound with a sterile gauze pad or dressing. Ensure that the dressing is large enough to extend beyond the edge of the wound. Then fourth step is secure with bandage. Use adhesive tape or a bandage to secure the dressing in place. Avoid making a bandage too tight as it may restrict blood flow. Our next and fifth step is monitor and change dressing. Regularly monitor the wound for sign of infection, example redness and swelling or any pus. Change the dressing as needed to keep a wound clean and dry. Dear learners, our next topic is burns care. How to care any burn injury. There are three types of burn injury: first degree burn, second degree burn and third degree burn. Let us see what is first degree burn. First degree burn is a superficial burn that affects the top layer of skin or epidermis. Symptoms include redness, mild swelling or any pain. Generally heal within a few days with basic first aid. Let us see what is the first aid of this first degree burn. First step is hold the burned area under the cold running water for about 10 minutes to reduce pain and limit the damage. Second step is apply a cool, moist compress. If running water is not just available, use a clean, cool or moist cloth. Third step is protect the burn. Cover the burn with a sterile, non-stick dressing or a clean cloth. Then let us see about second degree burn. Affect both the epidermic and the layer beneath it, dermis. Symptoms include blisters, severe redness, swelling and pain. It can take several weeks to heal and may require medical attention. Dear learners, the third degree burn. Let us see what this says. The most severe type of burn involving all layer of the skin and possibly underlying tissues, nerves or blood vessels. The skin may appear white, charred or leathery, extremely painful and paradoxically due to nerve damage. Medical emergency, seek immediate professional medical help. Let us see first aid for a third degree burn is a nothing but a medical emergency. Call emergency number 108 for India and seek immediate medical attention. Third degree burns require professional medical care. Do not apply water or ice. Do not cool the burn with water. This can cause shock. Cover the burn means use a clean dry cloth and sterile dressing to cover the burn and minimize the risk of infection. Elevate if possible means elevating the burn area can help reduce the swelling. Dear learners, now let us see first aid for fracture or sprain. What is fracture and sprain? It's important to distinguish between fracture, that is broken bones, or sprain, injuries to the ligaments or muscles, as a first aid and treatment may offer. First one is fractures or broken bones. Fractures are often accompanied by severe pain, discomfort, or an abnormal position of the limb or joint. You may hear or feel the bone snap or pop. Swelling and bruising can occur and the person may be unable to move the affected limb or joint normally. In some cases, there may be an open wound with bone protruding. Immobilization techniques for fractures. Let us see this process. First one is call for professional help, means dial 108 or seek immediate medical attention. Second one is immobilize the area. Keep the injured limb or joint as still as possible to prevent further injury. Use splint, means if available use a splint to immobilize the injured area. You can improvise a splint with material like rolled up newspaper or cardboards, as we can see in picture. Next step is secure the splint. Gently secure the splint in place with bandages, but do not make it too tight. Last step is elevate. If possible, elevate the injured limb if they does not cause further pain. Now let us see what is sprain. Sprains typically cause pain, swelling and limited mobility. There may not be a visible discomfort or bone prostration. Bruising can occur but is usually less severe than with fractures. Immobilization techniques for sprains. First one is rest. Encourage the person to rest and avoid putting weight on the injured limb. Second one is apply ice. Apply an ice pack wrapped in a cloth to the injured area for about 15 to 20 minutes every 2-3 hours to reduce the swelling. Third one is compression. Use an elastic bandage to gently compress the area to reduce the swelling and support the injured limb. Fourth one is elevate. If possible, elevate the injured limb above heart level to further reduce swelling. For both fractures and sprain, it's crucial to seek professional medical evaluation and care. Immobilizing is a temporary measure to prevent further damage, but definitive treatment should be provided by the healthcare professional. Improper immobilization can cause complications or worsen the injury. Dear learners, in next our topic we will see first aid for specific age groups, means special consideration for infants, children and elderly. First aid should be tailored to the specific needs of different age groups. Here are some special consideration for infants, children and the elderly. First we will see for infants at the age group of about 0 to 1 year. First step, handle the infant gently and support their head and neck because they cannot control their heads. Second one is choking. Infants have a higher risk of choking due to their small airway. Be prepared to perform infant-specific choking maneuvers. Third one is how to give CPR to infants. For infants, use 2 fingers to perform chest compression during CPR, as we can see in picture. Next one is children in age between 1 to 12 years. How to comfort these type of children. Children may be frightened or anxious during an emergency. Reassure them and provide comfort. Second, child-specific CPR. Use heel of one hand for chest compression during CPR on a child. Third one is emotional support. Offer emotional support and communication suitable for this age to minimize fear and stress. Next age group is above 65 or elderly. How to handle them? Be mindful of the increased fragility of bones and the potential for fractures in the elderly. Medications. Elderly individuals may be taking multiple medications. Be aware of potential during interaction or adverse effect. One is mobility and balance. Consider mobility and balance issue when providing assistance or moving the elderly person. Fourth one is respiratory problem. Older individuals may have respiratory conditions like COPD. Monitor and assist with breathing difficulties. Some general tips for this topic is adapt your communication to the individual's age and cognitive abilities. Dear learners, let us see conclusion what this session conclude. In this presentation, we have covered essential aspects of first aid, emphasizing its importance as a life-saving skill. We discussed first aid is the immediate care provided to an injured or ill person before any professional medical help arrives. Also, we explored the contents of the basic first aid kit and highlighted the significance of having one at home and in your workplace. We delved into providing first aid for injury like cut, scraps, burn, fractures, choking and CPR procedures. We explained the step-by-step process of CPR and the importance of automated external defibrillators AEDs in cardiac emergencies. As we conclude, we urge each one of you to consider the importance of first aid skill and knowledge. By becoming capable first aider, you can make a significant difference in the lives of those around you during emergencies. Remember, it's not just a skill, it's a life-saving skill that can empower you to be a hero in a critical situation. We encourage you to seek first aid training and practice regularly. By doing so, you can contribute to safer communities and be prepared to respond effectively when it matters most. Your willingness to learn and help can truly save lives. Let's make our world a safer place together. So, dear learners, in our next lecture, we will see hazard identification and risk assessment techniques in detail. So, thank you for your attention for today's session.